Okay, welcome everybody. This is Doug McCall from the International School Health Network, welcoming participants to the panel presentation, which was planned to be held in Miami in March. And with the COVID-19 crisis, we've, as many of you will know, has shifted over to a virtual conference. So we have several panel members with us today who are going to be each giving a presentation of about 10 minutes or so to be able to give you an overview. And as part of the Fresh Partners activity with this conference, we've organized 5 more full sessions, which will be which have been recorded or will be recorded, and will be available on the Fresh Webinars web page at the Fresh website, which I'll give you that link in a bit. So we're having a technical problem with seeing the slides as well as the screen. I could not upload the slides today. So I'm going to be showing them by sharing my screen, and the speakers will be presenting with me following by clicking. So welcome everybody. I'm going to just shift over to the slides, and everybody should be able to see the initial slide, which is School Health and Development, A Bridge to the Future. The speakers you see on the screen are going to be participating in order, with the exception of Dan, who could not make it today, and we do have a recording from him, which I think what we're going to do is just simply list as an additional recording to this one. So I'm pleased to introduce our speakers today, including Esther Kerr from the Brookings Institute, and Esther's currently in Australia, so it's in the evening for her. Martin Henry, who is the Research Coordinator for Education International, the Teachers Federation, and Martin is coming to us from Brussels today. Sung Lee, who is the Manager or Director of the School Health Program with Save the Children, and Sung is in North America on the East Coast. Deepika Marish is also on the East Coast from UNICEF. Deepika Sharma, sorry, from UNICEF, and myself, I'm coming to you from the West Coast of North America. So we'll be going through the presentations, asking for questions to be posted in the chat box, and then we'll come back and have a discussion about the crossovers between the presentations. So Esther, if you can just tell me when you need to advance the slides. I'm going to shift to the first one. I'm sorry, just a little bit more introduction with this slide. We're really pleased to be able to offer this series of slides with Fresh Partners, and each of the Fresh Partners has been very active in different areas. Martin and Esther are going to be talking about the whole child and a broad set of learning opportunities for all students, and it's a work that they've been doing together. The recording of the full session was done on March 3rd, and if you go to the web page noted at the top of this slide, Fresh Partners, the Fresh Webinars page, you'll be able to find the recording. The second session, which is going to be also recorded and available on that same page, is from Daniel Leitch, and it was on the work that's being done on health and life skills education through the Fresh Working Group on health literacy, life skills, and social inclusion. And Dan recorded his session on March 5th. It's a full discussion of that. It's really part of a broad set of learning opportunities, and it's looking at health and personal and social development education. Looking at this fact-finding survey that many Fresh Partners have been involved in, we had a session yesterday with Deepika Sharma and Emily Sidaner from UNESCO, and Deepika's with UNICEF, and it was discussing the survey that would be going to ministry officials and analyzing policy and curriculum documents to gather the basic facts about school health development, and nutrition programs around the world. On April 29th, Sung Lee and Mohini Vendigash from Save the Children will be reviewing the needs of low-resource countries. Save the Children has been leading a series of webinars on low-resource countries for about 2 years now, and so there's a real accumulation of knowledge that's been developed by Save the Children and a couple of other partners, and so if that would be on the 29th, which is next week. And then on the 30th, we'll be looking at another initiative that the Fresh Partners have undertaken, which is to add to the core indicators and the topical or thematic indicators that have been published as part of the Fresh framework. The partners have been working at looking at another series of domains or dimensions that are listed there, contextualizing the implementation, scale up, sustaining, and programs dynamic of moving towards expanding programs, building capacity, integrating within school systems, and also systems change issues. And I'm very pleased that we're going to have two people who have done very recent research reviews on those topics, and we'll be able to start out with a brief overview of those reviews. So that's giving you an overview of the session and the topics today, and I'm going to just go to the next slide, which is again a listing of the different reports. These are all going to be available on these slides on the same webpage as noted before, and you see the excellent array of resources that Fresh Partners have been producing. So looking forward to the session, and it's my pleasure now to turn it over to Esther Kerr with showing the slides. Esther, the Skills for a Changing World, and if you can begin there and just let me know when you want to move the slides. Thanks.
All right, thank you very much, Doug, and hello everybody. And so I'm speaking to you, as Doug just mentioned, from Melbourne in Australia, and it's our evening. So nice to talk to you. Now I'm going to talk about the shift that is happening in education in national systems around the world. And it's a shift, as you will see from the slide that we've got here, toward breadth of skills. I describe this reasonably frequently in terms of 21st century skills, which includes aspects of social emotional learning. So we're really looking at a holistic perspective on education. The rationale here is that if we want students to interact constructively with their world, then we need to provide them with an education that offers a broad set of learning opportunities, which we often refer to as BOLO, breadth of learning opportunities. So the idea here is that we can no longer accept that education should be compartmentalized only into some core discipline areas. And there's no doubt that this particular perspective has many adherents, and I'm going to talk to you about some examples of why we know that's the case. So clicking on to the next slide, where it's got the header Learning Metrics Task Force, we know that over, or probably about the last 3 to 4 decades now, we have had a lot of global dialogue about what education is, what global citizens are, and so on. So looking back, we had the UNESCO Delors report back in 1996, where we learned about learning to know, to do, to be, to live together, things like that. And then we had the DeSeco report out of the OECD, where we looked at different perspectives on what a learner might be in a knowledge society. Then we had the European Reference Framework looking at lifelong learning competencies. And then under the Assessment and Teaching of 21st Century Skills project, for which I was the research coordinator, we had this idea of ways of thinking, working, living in this world, and so on. So there was a lot of global discourse. Then about 6, 7 years ago, we came to the Learning Metrics Task Force. And the shift in this particular initiative was moving from that global discussion to, and very much around access to education, to looking at access plus learning. And we were starting to then engage at national levels. So the Learning Metrics Task Force, LMTF, was a multi-stakeholder collaboration. It was led by UNESCO UIS and by Brookings, and it was guided by 3 questions. It was, what learning is important for all children and youth? Should we measure learning outcomes? And how might measurement of learning outcomes improve education quality? And what I'm wanting to take from that in particular is this image, though, that you can see in front of you here. And that image shows these 7 domains of learning that were identified by LMTF. as being applicable from early childhood through to post-primary schooling, although it acknowledged that different domains would be differentially important at different times in the life trajectory. So, I think in retrospect, the major contribution of LMTF was about consolidating this whole child view of education, and particularly raising awareness of country stakeholders about the need for assessment data that might inform their systems. So clicking on to the breadth of learning opportunities slide, you'll see here what we actually worked on. After LMTF, Brookings became engaged more in this idea about breadth of learning, and Martin Henry in the next presentation will talk about this work in more detail than I will. But what we did in this initiative was we used that 7-domain model that you saw out of LMTF to provide a framework for a tool, a breadth of learning opportunities tool that would help national systems analyse the degree to which their education policy and their provision reflected a breadth model. So it would show the degree to which breadth is reflected through different layers of the system. And as you can see on this slide, we adopted this intended, planned, implemented model structure. So the intention of the tool was to capture data at each of those points across different layers of an education system, from policy to curriculum to practice in the classroom. And I know Doug has provided links to the tools and the toolkit in the slides that he just showed earlier on. So the tool itself has 3 versions. It's got a policy, school, and teacher curriculum questionnaires. The tools is meant to be just used as a diagnostic. So it's not telling anybody how to do anything. It's just a way of mapping out what is happening in a system. And equally, you could use this with frameworks other than the 7 domains. It really wouldn't matter. So it's more of a conceptual approach to how we can move along. So if we click on to the next slide, visualizing the breadth of skills movement, a question, of course, having put the BOLO tool together was, well, is it realistic actually to think that national systems are looking at breadth of learning opportunities? And so as it turns out, it was actually very realistic. In this Brookings study that we started up in 2015, we analysed how national systems incorporate 21st century skills into their education mission and vision statements. So 21st century skills being one aspect of this whole breadth perspective. Not all of it, but one part of it. And so we looked at over 160 countries and identified the degree to which 21st century skills were captured in education mission and vision statements, how they were captured in curricula, and how they might be captured in learning progressions. Well over 70% of those 160 countries were mentioning 21st century skills as part of their aspirations for learners. So it's very, very clear that there was a shift in education. However, one of the big issues is to what extent has that translated into action in the classrooms? And that's where a new initiative that we're looking at this year comes into play. So if we look at the next slide, we can see from 2016 to 2019, we were picking up quite a lot of information about what was happening in this shift. We found this issue around gaps between aspiration and practice that Martin Henry will talk about. And we got that from the breadth of learning opportunity tool. We had the findings from the mapping that I've just very briefly showed you. We also did some qualitative case studies in 4 countries, South Africa, Mexico, the Philippines and Kenya, where we were looking at different stakeholders' perspectives on including a broader set of educational aspirations. And then just last year, we did some work comparing what's in the curriculum in the Philippines to what's actually happening in the classroom. So lots of different things coming together to show us that there's shift, but it's not uniform by any means. And what's happening later this year now is that IEA is initiating a new study, 21CS MAP. And this study is going to enable countries to review how 21st century skills are integrated through layers of their system, as well as look at how other countries are structuring and synthesizing the skills through their curricula. So this will be a much deeper and more accurate approach to looking at what's happening if we compare this to, say, what was happening in the Brookings mapping. We were originally scheduled to have our first in-person meetings in July this year, but naturally the start date has shifted while we have education systems, as we know, all over the world just trying to work out how they can get education to the students on a continuing basis. So later on in the year, do look at the IEA website for news about what our new start will be on this particular study. But it should give us a great deal more understanding about actually how do you integrate breadth of learning through a curriculum? What are the different approaches different countries are making? How can we learn from each other as we move toward some changes in our education system? So thank you for listening. Please take advantage of those links that our convener Doug McCall has put up in those slides, and do reach out to me for any questions that you might have at Brookings. Thank you very much. Over to you, Doug.
Thank you, Esther. Excellent overview of the work that you and Martin have been doing together and separately. It's really great to see. Going on then to Martin, if I'm now showing, you should see this slide, breadth of learning. And Martin, if you could take it up, please.
Okay, thanks, Doug. Hello all, and I'm talking to you from a kitchen in Brussels at about lunchtime. I just want to acknowledge the sort of unique and extremely strange times that we live in around the COVID crisis, and how that's emphasizing the importance of curriculum and the whole child. And as Esther said, the movements that were made towards whole child education by Brookings, we completely supported, because we have felt that a narrow approach to learning, one that's focused just on literacy and numeracy, one that goes down a narrow pipe, is not beneficial to the whole child. And we work with Doug on the same issue, because the whole Fresh Partnership is looking at the whole of the child, the whole of the self, and it should really be about learning through the whole of the life. So I'm going to talk about that a little bit as I go, and I'll talk about the particular examples that came up from the breadth of learning work that we did in both Kenya, where we looked at secondary school students, and Zambia, where we looked at primary school students. Next slide, please, Doug.
This is showing the curriculum developments.
So, as we heard from Esther, there are a number of steps that got us to this place. I'd like to interleave them with some other particular pieces of work that are going on at the moment. The SDGs, Sustainable Development Goals, in particular four, but Yusuf Saeed, who we've been working with, and I'll get to his work in a minute, also talks about the connection between all of the SDGs, and I think education has quite a long way to go in that. When you talk about education for peace, or education for sustainability, or education for decent employment and proper life chances, that's a much bigger sort of piece of thinking that we all have to start doing in a way that's a little bit more textured and lined up. The OECD are also working in this area on the 2030 curriculum framework, which is a piece of work that is aligned to the work that was going on in the Learning Metrics Task Force, and looks with OECD countries at how curriculum should be more than just what is assessed in PISA. It needs to be thinking more about the whole way in which so-called soft skills, in which the elements of the child and their interaction with their community are taken more as part of the educative process. And I was lucky enough to work early on in the New Zealand curriculum development back in the early 2000s. And they brought some strands into the curriculum there that were looking, as a result of the DESECO work around that area, and it opened up education into a number of places that were clearly areas that all teachers deal with on a day-to-day basis, but hadn't really been systematized or made formal in the learning process. I think we're now all working on how we can do that in a way that is both sympathetic to whole child development, but also understanding of the need to provide support, assurance, assistance, and teaching around the areas that we need people to pick up on. And the sort of things we're talking about are participating with others, working around a whole lot of senses of understanding the importance of other perspectives, or of being able to work around the physical self, but also the wider sense of health. And I do want to acknowledge the work Doug's been doing in this area, because I think there's a whole lot of ways in which health is not just about running around a field, it's about the whole way in which we connect to society. And I think there's been some important work done in those areas. Also, when I speak about curriculum, I always talk about the written, the unwritten, and the hidden curriculum. And if we take the example of the breadth of learning work that we did, if you take the example of Kenya, where they had a curriculum that was looking at developing ICT, developing a whole number of things that were going on in the country that were very important in terms of international understanding of where curriculum should be. Yet the exam system drove behavior, which meant that students may turn up for a PE lesson only to find that they were going to be taught chemistry because there was a chemistry exam the next week. So we did some work in the instrument we developed there at looking around the areas of the breadth of learning at what actually was delivered, as well as what the curriculum said should be delivered. And it's not always the same thing. And that is a question that I think countries need to wrestle with in a real and evidence-based way. And we found there, we had 10 participants who went to 3 large secondary schools each. So we had a large sample of about 38 secondary schools in the end, which gave us a number of teachers working together on answering those questions around what was actually happening as opposed to what was written just on paper. If we go to the Zambian example, there we looked at primary school teachers. So it was a different set of thinking. I'm not quite there yet, Doug, but it's a good graph to look at.
Sorry.
And in Zambia, that there was again a strand within the curriculum on ICT, for example, that said that all primary school students should be taught ICT, and yet the group of teachers we were working with, many of them didn't even have access to email, let alone computers or an understanding of how you might integrate with technology to be able to teach ICT in a blackboard-driven way without an ICT infrastructure is plainly impossible. So that was a discussion that we got into around how we should be able to line up those elements of written, unwritten, and hidden curriculum, and how we can open up a conversation between teachers' unions, and I should have said at the start, Education International are the union of teachers' unions, so we represent the teachers. How we can get teachers in a position where they're able to understand the differences between these curricula, and how we can look at educating students in a more holistic way so that there is a better experience around the whole of learning for the whole of life. There's a document on this slide that I wrote with the team from Brookings, and it lays out the sort of ground we covered. I'm going to talk now a little about Yusuf Saeed, who is a professor who works out of Sussex and South Africa, and he's also done a great deal of work with UNESCO and many other bodies, and has worked with us on our professional standards framework, which we've developed for all teachers, and did some work with us around countries in Africa that we were working with General Secretaries of the Union and senior leaders from the Ministry of Education. We were having a conversation around curriculum and how it works. We can go to that slide now, Doug. So you can see from this slide, so this is Yusuf's thinking about the way a student is framed in terms of the things that swirl around them. So if all we do is we look at government documents on curriculum, for example, we only get an understanding of the teacher policy part of what's happening and the student policy part. We don't get an understanding of actually what's going on in the classroom and the relationship the student and the teacher have to the learning that's in front of them. So you will see in the way that that is encapsulated with the things which are going on around the quality teacher and the student learning, that there are a whole lot of things that are coming into play. So we've got teaching competence, we've got attitudes and values, we have professionalism, and autonomous professionalism is something I'm very passionate about. And if you're interested in the professional standards framework, please get back to me. It's a joint EI UNESCO document, and it lays out a structure for how professional standards might work. There are a whole lot of questions around relationships and accountability, and accountability has to be something which is transparent, open, and flows between student, teacher, school, school system, and so on. It can't be a technicist checklist approach which is driving a blame culture around what a teacher is prepared to do. And Doug has been a great ally in this work, and we believe that it's absolutely critical that everybody in education understands their role and is supported to deliver it. So that's where we get to the teaching practices and the teaching competence. I've been a classroom teacher for most of my career, and the way in which you teach and the pedagogical support that you have available is absolutely critical. Professional learning and development is another passion of mine, and the way in which we support teachers to lead the type of learning which is going to open up those whole child approaches and those holistic ways of thinking about education are absolutely critical. Now, there are a number of things that interplay on the outside there, and you'll see social, cultural, economic, and political context. And the international context has a huge influence as well. What happens with PISA, with TALIS, with TIMSS, with PEARLS, with PASEC, with SACMEC, these international instruments which are about benchmarking student learning have a huge influence. And I want to pay tribute to the fact that we tried in the breadth of learning work to open up that question of what an international instrument is into a more dialogic way of thinking about how a teacher, a system, and a student might all be connected in a closer way around thinking about what is actually happening rather than what people say should be happening. Next slide. Thanks, Doug.
With 10 countries in the curriculum.
Yeah, so this is a sketch of the countries that we were dealing with. So we've worked with about 14 African countries around this. We had Francophone, Lusophone, Anglophone, and the mix of conversations and the richness of the discussion. And this project, I should acknowledge, is a partnership between ourselves, the Open Society Foundation, and we work with the African Union as well on how that all came together. And what Yusuf did is he went round and actually analyzed curriculum, professional learning and development available, etc., around the 10 countries, and he's grouped them into some areas where we can think about what is happening. So you'll see there in the first group, Burkina Faso, Cote d'Ivoire, and Madagascar, and they have curricula which have been developed, but they do not deal sufficiently with the 21st century question that Esther's already brought up. I'm a bit of a naysayer on the 21st century framing, in that I feel as though we're already a fifth of the way into the century, and we're talking about it as if it was very, very new, and it's not new anymore. We know from the DeSeco process and from other bits of work that have been going on for a long time that many of the things we're talking about now were present in 1970s education in London, for example. ILIA were leading many of these conversations, and many other places. So I think that curriculum is something that evolves, and I'm going to talk a little bit more about that. I'm aware of time, Doug, so I'll keep moving. There are a number of ways in which the countries in this strand have some important developments that they've made, but there are still gaps that need to be taken care of. Group 2, we have Kenya, Malawi, South Africa, Uganda, Zambia, and Zimbabwe, and they have new curricula again, but they're insufficient in preparing teachers for the things that they have to do in the classroom. And curriculum and assessment policies are not aligned or are lacking. They do have 21st century knowledge, skills and attitudes in their curricula. They do have a competence-based curriculum. They do have lifelong learning and inclusion, and they do have an alignment to SDG 4. So they're to be acknowledged. And this was the eye-opener for me. Group 3 is Mozambique, where in their curriculum they developed a whole number of things that had some quite innovative approaches, including cross-cutting themes, transversally approached scenarios, such as the Australians brought in with their curriculum reform a number of years ago, which Mr. Adams, the Prime Minister, unfortunately jumped over, but they have gone back to a number of those, and New Zealand have done a similar thing, and many places around the world. How you actually work around the cross-cutting issues without just calling it cross-cutting and ignoring it, which is another tendency. Inclusive and quality education is clearly at the center of their document, but there are a lack of appropriate conditions for those policies to be implemented. So they've actually done some really good thinking, but implementation, which is always the biggest challenge, is where the struggle is. Next slide, thanks, Doug.
It's about it's all about implementation. Is that slide?
Indeed. So curriculum should not arrive like thunder. When Yusuf spoke this to the room of people we had working in this in Ghana on Cape Coast last year, everybody looked at him and just sort of mouth agape that that's exactly what happens far too often. Curriculum is something that we should understand. So we're not against revisions. It's not that we're saying that we should not have revisions. It's that we want to be involved with them. And teachers need to be front and center to any curriculum changes, any curriculum shifts that are taking place. And just thinking on a sort of formulaic level, looking at frameworks and what have you, and we learnt in that seminar the number of frameworks that people are dealing with doesn't really assist African countries to work out exactly the best way that they need to be implementing. And this is an area of interest that we really have to pay more attention to. An old friend of mine from New Zealand, Adrian Alton-Lee, who came up with the best evidence synthesis, talks about implementation science, that there is a whole lot of work that has gone on around this. We do actually know quite a lot about what works and what is best, but we're terrible at living that process of actually making sure that we involve everyone along the way, teachers' unions, perspectives of others. We have to make sure that we've got those groups in conversation so that we don't have a delivery mechanism that is purely one way. And interestingly enough, we've just done a COVID-19 survey with all our members, And we've had 103 responses out of nearly 400 members, so that is a huge response rate, representing about 65% of over 30 million teachers. And they've told us that actually in countries where you have unimodal modes of delivery in response to the crisis, that success for students is more problematic and equity is driven down. Where you've got multi-directional modes of delivery, you've got a much better chance. And that multi-directional really reflects what we're talking about here, that you have to have open conversations through the education system that are enabling everybody to get involved in a positive way. Next slide, thanks, Doug. I'm aware time's nearly up, so I'm wrapping up now. Rethinking professional development models for curricular change is absolutely critical. We have to abandon the cascade model because cascade does not work. So we've had so many years where people have said, I'll run a pilot, I'll seed a bit of thinking, I'll just do it in this one place, and magically everyone is going to learn from this example. But I'm afraid it doesn't work. The last person to be trained has got only half of the training. In other words, the information which goes to the first teacher does not go to the last teacher. And we end up with a Chinese whisper scenario where the message gets mangled and proper implementation cannot be assured. The only way we can assure that is through good, solid, continuous professional learning and development that happens across all schools, that is supported by evidence. So on that evidential end, given that I'm a research coordinator, Doug, I'm going to pass back to you, and I'll be interested in the perspectives of the participants and how we can further this way of working. Thanks, Doug.
Thanks, Martin. And just to be clear, and your kind words about my work, it's actually the work of my 70 best friends who are members of the Fresh Working Group on Health Literacy, Life Skills, and Social Inclusion, chaired and led by Dan Leach and I. And so we've been really learning from each other over several sessions. And so just to make that clear, our next speaker is Deepika Sharma from UNICEF, and she's going to be talking about similar to a little bit of, quite a bit of similarity with Esther's work, with a more of a focus on school health and nutrition and development, and broadening some of the notions of the 21st century skills to more of a life skills and health and wellness kind of approach. So Sharma.
Thanks, Doug.
Thanks
for the others for setting the tone. Yes, at UNICEF, we are working on this area of school-age children and adolescents, and we are following I agree with you, Martin, when you said when you talked about the whole child approach, and that's the fundamental for us. Although internally we work sectorally, like health, education, nutrition, but the purpose is to serve to the whole child approach. So in my presentation, the next few slides, I'm going to introduce about fact-finding exercise that we plan to undertake with Simon Fraser University, International School Health Network, and a few other partners. And so this work we plan to start it in the next quarter, and it's fact-finding survey, data gathering exercise from 300 plus countries. Next, please, Doug.
Showing the current state of data gathering.
Yes. So just to this, as I mentioned, this fact-finding survey, we want to understand the current approaches on school-based, school-linked interventions, and also to understand that how the various approaches are embedded into the current policies, not only the education policies, but the various other policies of various ministries or the systems. For example, how these our components are embedded into the health policy, into the Ministry of Education, the Ministry of Health, into the food system, into WASH and other systems or ministries as well. And we want to use this information to monitor and inform Target 4.7, which focuses on learners and which also includes sustainable lifestyles. And although there exist at present, there are various tools which are measuring, if not the whole, but some parts, some aspects of this school-based school link intervention. For instance, there are tools such as SABRE from World Bank, which is the system's approach for better education results. It helps to assess the policy programs, but the thing is that not many countries are using it. And similarly, there are other initiatives which have been supported by WHO, like the Global School Health Survey, which is about the status of children 13 to 17-year-olds, and the Health Behavior Survey. These are all self-administered questionnaires that you may be knowing, and the assessment is around, say, alcohol use, dietary behaviors, drug use, mental health, physical activity, and various other aspects. But not all countries implement this. It is mostly focused in high-income countries, and most importantly, the surveys are administered only when the country has some kind of external support and funding available. So it's not into the data monitoring systems of the country. And similarly, on the WASH front, there have been some momentum, and there is an attempt to monitor the SDGs under, which falls under Goal 6. And other initiatives are also there, like the Global Nutrition Policy Report, which was out in 2016-2017. But through it's not that the fact-finding survey would be a standalone survey or a standalone data gathering exercise. But through this exercise, we want to build the body of knowledge that is available, the information that is available, and also like to understand that, as I mentioned earlier, how the school-based schooling intervention are embedded into the current systems or ministries' work. Next slide, please, Doug.
Existing approaches.
Yes, absolutely, on existing approaches. Thanks. So this is the fundamental, and this is the school health and nutrition landscape. There might be some other approaches also. Various approaches have been re-christened and named differently, and but some or the other, they contribute in their own manner to the whole child approach. So you all may be aware about the framework, the FRESH framework, which is really focusing on the 4 pillars, and to monitor and internally to monitor the process, there are these 15 thematic indicators. I think Sung is on the presentations, also on the panel, and it's very close to her art, I know that, and she has been able to add to this body of knowledge. So the FRESH framework is the kind of infrastructure or for delivery of the other multi-component approaches. The other multi-component approaches focus on, because they are supported by different global partners, either it's called the health promoting school, which is supported by WHO, the child-friendly schools supported by UNICEF, similarly nutrition-friendly school initiative, the safe schools, the WASH school, the essential school package, and there are different aspects that are covered under these approaches, such as health, nutrition, protection, justice, municipalities, and sanitation, the urban environment, and the other and the other environments, the physical environment as well. However, the goal of our survey would be to support various countries. When I mentioned countries, I already said that this survey is going to be implemented in 300 plus jurisdictions, and UNICEF is working as of now in 81 countries on school-age children. So this body of this information is going to help the countries in programming and definitely identifying barriers and then working with the governments to move the efforts that are on health, nutrition, and development, especially for school-age children. Next slide, please, Doug.
On methodology.
Methodology. So this is how it will be administered. As I mentioned, that the entire framework of the fact-finding survey is the school health and nutrition, but based on the fresh framework of what is the status of policies, how various ministries contribute to the policies, what are the services available, what are we doing on the physical environment and the social support. This survey is going to help us identify what are the various priority issues that the countries have identified, what are the subpopulation the government is focusing resources on, and have the situation analysis being done in a robust manner, what is the quality of implementation, and whether the country is participating in other global surveys or data gathering exercise, and how the health, nutrition, and development is integrated into the education systems as well as into the other systems like the health or the social protection systems, and what is happening around the budgeting. Are there line items on school nutrition, health, school health and development in the budget of the ministries. And in the next slide, please, Doug, on the I think there was one slide on the domains. Yes. So
Sorry. Yeah.
the previous slide. Yep. That's okay. These are the 6 domains around which information would be gathered from the countries. 6 domains we would like to demystify the various aspects that are covered under the policy. Whether it is around prevention of disease, promotion of healthy diets or lifestyles, food environments, physical environments, barriers, overcoming the various barriers to learning. And an inquiry would also be made into what are the current standards, what are the minimum set standards as of now, what is the basic protocol in the country. Is there a set standard for health and nutrition services that are to be provided in schools, and how the other ministries are supporting not only the education but the other ministries, as well as how UN agencies are contributing to the school-based, school-linked intervention. Sorry. Is there a coordination mechanism around to enhance the effectiveness of the various efforts on school-based, school-linked programs, how the films are distributed? So all in all, the 6 domains, starting from the core components, understanding the situation or the country context, how the systems support the initiatives, what is the organizational capacity, what are the efforts that have been invested in building the organizational capacity, how well the health, nutrition and social development integrated into, and the skill development and social inclusion integrated into the core mandates. And then there would be definitely questions or a section or a domain on sustainability, which talks about the how the country prioritizes and how it invests funds in this approach. Slide, please, Doug, about the content analysis. Yes. So the purpose is that when we send out this fact-finding survey to the various countries and jurisdictions, then we would be getting a set of data or maybe documents that the country offices would be sharing. Through that country, through that those documents, we'd be doing the analysis on the personal and health, nutrition, personal and social development. So we'll ask about what are the curriculum structure, how much instructional time is there, sorry, what are the coherence between the various frameworks, and similar other questions. So all in all, the content analysis will help us examine how health, personal, social development can help promote health, literacy, life skill, and social inclusion. And there will be questions around which curriculum structures are being used by the country. Is it health education only, the life skill, or is it physical education and health combined? Is it career education? So just to understand and map out that scenario, we'll have questions on minimum number of hours or instructions that are being devoted or mandated for HPST education. What are the learning objectives around knowledge, attitudes, perception, and building students' agencies? So it's a lot of questions, and that would be this information would be curated from the content or the documents that the countries would be sharing with us. And we have been inviting people, because this work is with various other partners, Dan and Doug, who is the driving force behind it. So we'll be setting up a group of researchers to help us curate this information and then inform the work, the implementation, and the policy in various countries. So we will be sharing, I think we have already shared the link of the fact-finding survey, which is just an initial draft, but for that, with inputs from you all and various other partners, we are going to have a very robust tool, and we would like to invite your inputs into that, into the survey to strengthen it. Thanks, and now I would like to pass the baton to Doug to take us over the rest of the presentation. Thanks.
Okay, thanks very much, Deepika. And the survey and document analysis are in some ways quite similar to the work that Esther was describing, although the focus is perhaps more narrow in terms of health and life skills, and it hopefully will increase the interest of the monitoring process in the SDGs towards these kinds of issues. Talking about learning from best friends, my pleasure to introduce Sung, who's been working on the Fresh webinars. Her and her colleagues have been doing a super job of building up knowledge in a series of webinars led by people from around the world on primarily from the low resource context situation, but and some I'll ask Sung to step in and take it from here. Sung?
Hi, can everybody hear me okay?
Yes.
Great. And after this, I'm going to have to drop off since it's already 8 o'clock. But just to say thanks for doing this, Doug. It's interesting to see these different points of views and the wide range of topics. And as Doug mentioned, I've been working on, and Deepika mentioned, I've been working on Fresh for about over almost 20 years or over 20 years. And I'm losing track of time. And we've been doing the webinars for several years, and then recently we switched it over to Fresh Partnership so that it doesn't become just about, say, the children's experience, but really looking at the partnerships and all the different experiences that the partnerships have. and then able to share it out. So this slide just shows some of the sessions from last year. And then skipping to the next slide. And Doug, I can't see the slides at all.
Sorry, the slide is many lessons have been learned.
Great, thank you. I've been having IT connections. So I'm going to spend my 5 minutes here, and the rest of the slides I think either Doug can speak to or it has enough text in it, so it should be okay. But so Save the Children it's been interesting. I've been working on school health and nutrition for over 20 years, and I hadn't thought about the different contexts, and I started working with Doug, and like, oh, you focus on low resource countries. And so that's been something that I've had to switch my mind around a little, that there is school health and nutrition in the other parts of the world, because I worked so much on the development context, and school health and nutrition is viewed as a framework that allows us to really take advantage of school systems and add the health and nutrition pieces, something as we've been talking about, the whole child needs. So it was a response to low resources of the countries we're working in. And so therefore it really was a interesting point of view to see that, yes, I used to go to schools where there were school nurses and so forth, and that's one model of it, but I am very much used to working in different contexts, but in much, much lower resource contexts. So, but I just wanted to cite an example of just most recently, I've been talking with our teams in Vietnam and Niger, and COVID-19 has really highlighted the importance of some of the activities we've been doing through school health and nutrition, in particular hygiene education and WASH. And in Niger, we're still working in schools where, where they're wondering where the next bucket of water is going to come. And in Vietnam, we are actually talking about the difference between hand sanitizers and soaps. And these are both in the same, obviously Vietnam's economic status is changing, but in the global context, these are considered low resource countries. And a few years back, when I worked in Sudan, they also were using the nurse in every school model, except they didn't have enough nurses for the hospitals, let alone in the schools. So I think that's just to acknowledge that when we are looking at the low resource countries, there really are differences, and we need to be flexible and looking at what can be done in each of the contexts. So this goes back to the FRESH framework, and this statement might seem a little simple, but having a framework that is just 4 pillars and having all the UN agencies acknowledge these are critical pillars and not get too deep into the details until it's time to actually implement, it allows the programs to be very comprehensive, inclusive, and adaptive. And I think the comprehensive is something that we all want, but in the low resource context, that does actually create some issues, and we do have to work on prioritizing and looking at what is important. And also, just to, over the 20-some years, some of these activities seem so obvious, but it does require piloting and demonstrating and then scaling up. And that, I think that's my history with school health and nutrition within the FRESH framework, within Save the Children's own work, has been that things have changed, not just because of time changes things, but because we've been focused on demonstrating and then taking that demonstrated activity and being able to scale up. And I think a good example is the deworming piece. It's something that 20 years ago, SAVE was hands-on helping deliver the actual deworming tablets to to schools and to students, working with teachers directly. 20 years later, this is an activity that most countries, most governments have taken on, and the role of an NGO has changed, the role of education and health has changed. And I think that's the other piece, is that looking at different roles and responsibilities of each of the players. And coming as an NGO, our roles have changed, but it's a good change in that we were able to work on some activities with the ministries and being able to hand it over, and then now having a role where we're on the ground playing more of a checking in, monitoring, and quality control, as opposed to actually implementing an activity that has been shown to be effective for education and health outcomes. Therefore, the ministries have taken those on as part of their policies and their activities. So again, the changing roles and responsibility, it's taken some 20 years and the work isn't done yet. We still have continue to work with partners to try to make sure that children are dewormed. And again, the COVID-19 thing it has put in a different emphasis on how you actually group children. So that I'm trying not to talk about COVID-19, but that's all we seem to be talking about. And then looking at the simple but comprehensive framework of SHN, school health and nutrition, it allows us again to look at what's necessary in each country. And malaria in schools, for example, 20 years ago, malaria for school-age children was not an issue. As the epidemiology of malaria changed, as we were doing a better job of prevention for malaria, the need for malaria prevention and treatment in schools increased. And therefore, we were able to bring that into school health and nutrition programming and been able to work on piloting and including new activities. Menstrual hygiene is a critical piece, and actually next month the FRESH webinar will be about menstrual hygiene, but this speaks to the change in the education system. So the malaria example shows a change in the health system, but the menstrual hygiene is an example of the education system changing. 20 years ago, girls in school were mostly in primary school. As we've done a better job of educating girls and bringing girls into school, there are more and more girls of menstruation age in schools. So that is something that we hadn't talked about 20 years ago, but that is critical now because the education sector is doing a better job of getting girls in school. So again, adapting because of changing nature of school population. So these are all just examples. Again, I'm sorry to be rushing, but I think everybody has talked about it, and anybody who works in learning and education also acknowledges that the different age groups have different learning styles and different learning needs. So that's also another piece of this important school health and nutrition activities, adapting it for the age groups, adapting it for resources available, adapting for teachers and personnel, and then also adapting for the context, humanitarian and development. Oddly enough, humanitarian, there is a greater need, and often there is greater resources that are poured in post-crisis response. So currently we're getting more opportunity to look at hygiene education and WASH activities because of COVID-19 than we had in the past. It's an odd paradox because of how the funding is out there, but looking at how we adapt and use those opportunities and to make sure that that continues into a sustainable set of activities during development process. I think that's the other piece of it. So these are things that we've been doing for 20 years. During the webinar series, we bring on a lot of practitioners. We have researchers, we have policymakers, and looking at all these issues with the really actual experience from the ground together. So it's not just about research, but actually looking to see what's happening. And so the FRESH webinar has been a great opportunity to share the experiences among different partners. And it's interesting to see lessons being learned and tweaked from each other and through the times. I feel like speaking as somebody who's working on 20 years, I know Doug's been working on this a little longer, but it's been interesting to see the adaptation and changes and the increased interest in it. So I'm going to stop there, Doug, and I think the next slides are really self-explanatory.
Yeah, and I sure, and I'll just take people through them quickly, but just to pause here and talk about the wisdom that's been accumulated from those 50 sessions. The Song's 50 Best Friends have really made a real contribution, and if you're tired of binge watching Netflix in this difficult time, go to the web pages on the FRESH website and take a gander through some of the webinars. They're recorded and the slides are there, and it's a really good read. I spent Easter weekend catching up on many of them and trying to put them into the document that is referred here. But the document itself is real resource. And that was provided with a little bit of funding from Plan International UK and AstraZeneca to be able to allow us to reflect. And to make a bit of a segue, the last point on this slide, the humanitarian versus development, there's another group, network quite similar to FRESH, which is focused on education in emergencies, and INEE, and it's done a good job of getting folks to pay attention to the needs of that particular context. And I think what we gathered up in the FRESH webinars and hopefully in the discussion paper and in the consensus statement, some focus of attention on the needs and priorities and ways of exchanging knowledge in this low resource country context. And as the first point says, these countries are not homogeneous, and there are differences, but there are also similarities that people in those countries and elsewhere can learn from. And so that's kind of what we're trying to do in there's a draft consensus statement which has these principles, which are again pretty straightforward. I'm not going to walk you through them, but being able to set out some working principles based on practice that we can define for this context, and then trying to suggest in the consensus statement some actions that global organizations and donor organizations can help to extend this focus on low resource countries. And what we're trying to do is to get this context, like other settings, other contexts, to be able to take a more of a systematic approach, as the many dimensions that Deepika was mentioning, one of them being contextualization, or helping to understand your context. This are a number of actions that could be taken by UN agencies, by research funding organizations, by donor organizations to take these kinds of actions. And the consensus statement that is noted there can help you take through those kinds of things. And I'm going to just drop down to item 8 there with there's some really good examples of how teachers have in schools in low resource countries are a real resource for the health and nutrition programs and other urgent programs needed in that setting. But it may not be sustainable, and so we need to think about how do you move to providing resources that are, if we're going to be dependent on teachers, there are models where teachers are assigned and trained to being kind of a combination of a school health person and a teacher. Japan has that kind of a teacher assignment, as does Oman in the Middle East used to have that kind of assignment. Is their way of organizing that better to make it less of an accumulation of tasks for teachers. So these are kinds of things that we need to think about as we develop our knowledge around this particular setting. And Sung and her colleagues have been a real driving force over the years, both for the FRESH framework, which is generic to be able to cover all contexts, but also in developing the knowledge about this particular context. And so I'm going to Sung, I know you're under time pressure if you need to drop off, but any final thoughts before you go? I'll give you that chance.
No, thanks, Doug. I do think that your last point, and it was interesting what Martin said about cascading training. There's a lot of interesting conversations, but I do think trying to figure out how to make this work, and sharing the responsibilities across different partners, and I think as Save the Children, one of the things is looking at children as part of that process, and I want to emphasize that. But also acknowledging their children, so looking at what roles they can play, the communities can play, in addition to what teachers can actually carry on their backs. So thank you very much.
Thank you, Sung. A nice segue into the final set of remarks, and I'll cover these quickly because there is a draft document that is referred to here. Another project that FRESH Partner has been working on is developing the FRESH cross-cutting themes. And as noted before, the FRESH framework, when it was developed over the years in the 2010 through 2014, defined the core components, which are pillars for any particular approach. But also they're used as domains to organize programs and interventions. And so we need to use that, not to lose that idea of a solid framework, but then also to have multiple interventions around different topics, be they nutrition or physical activity or HIV/AIDS or bullying or whatever the issue of the day happens to be. But the idea is that you have a core set of infrastructure, a core set of components, such as a core health life skills education program or defined set of services, but you also have to adapt and apply those to the different settings. What's changing is the kinds of shift to a more of a systems approach. And in Deepika's presentation, she talked about the items listed in that paragraph there, but they're contextualization, system and organizational capacities, implement, maintain, scale up, and sustain programs. There's a variety of dimensions or domains that are new, and it's kind of a shift. And so the Fresh Partners have been working at this for a while, and so we've developed a bit of a document on cross-cutting themes that we're trying to identify those different domains or dimensions, and then try to get down to brass tacks and look at how those kinds of new dimensions can be implemented in a practical way, in a way that people can understand, and that there's ways that it can be done. And just as this slide says, the good news is this is not so new anymore. As Sung was saying, with those of us with 20 or 25 years of experience in this, sometimes you are so busy worrying about our mistakes in the past, you don't realize that there's a new generation of young people coming up that have been starting to solve those problems. And there's two references there that I recommend highly to you. They'll be on the webinar on the 30th, and they'll be showing how not only has the research started to understand this, they've started to apply it to health promotion. They're actually now applying it to school health promotion. And so the agenda has moved, and we're making progress. In the document, I'm not going to spend too much time, but I'll give you this one as where we were. The criteria is a complex process of trying to do a situation analysis and to be able to understand your context before beginning. And part A there is talking about doing that properly, and part B is that there's actually a series of published evidence-based experience testing tools. And so this is an example of a complex process of doing a situation analysis that has now progressed to the point where there are a variety of tools, not only for school health or development in general, but also applied to different issues. And so you can see that our knowledge has advanced in this, and the draft document tries to catch up with that. Here's an example of one that is complex as well, but doesn't yet have a kind of a practical tool that we can start to work with. And this is looking at truly at addressing the disadvantaged or vulnerable needs of students, and so being able to take that as a priority and focus on it, and then assess where you're at. And you can see our advice there is really to list and assess what you're doing. It doesn't have a particular tool or planning tool or a guide that you can use yet, but I'm sure that we can develop those in the future years, and our younger people will be able to do that for us. Here's another one, yet again with a standardized method. Without a standardized method, this is the programs in school health promotion. Usually the talk is all about what the education sector can do. This new thinking is that it also has to be embedded deeply into other sectors, so that in health and school psychology, for example, need to be embedded within a health ministry commitment to settings-based health promotion, or that school health services delivered by nurses needs to be embedded within a health ministry commitment to a primary health system, or that school safety is really part of crime prevention and community policing within the law enforcement ministries, and so on. So those are the kinds of complex issues. We didn't necessarily have any standardized tool yet, but I think we can start to work towards that, and it's one of the concepts in the document. Here's another one where there is a complex assessment that is supported by a number of tools. This is looking at implementation and maintenance issues, and so there are a couple of tools that are being widely used. I'm looking at the REAIM framework. There's a lot of work that's been done using the REAIM framework, and so this is where you can ask a question: have you used that kind of a tool, and what's been your experience, rather than just leaving that big challenge to folks. And then the I may have skipped. No, I guess that's fine. So, so that this is the kind of discussion that we're hoping to engage in terms of looking at this new set of domains or dimensions, and the cross-cutting themes page is mentioned on the Fresh Partners website, and I invite you to join us in discussing that. So I'm going to flip back to, and I know we've taken more time than we had thought, but I'm going to go to just to wrap up and ask for our speakers to any thoughts as we close off this session. We've really been fortunate to be able to learn from each other today, and as Joanna has said in her post there, that this is thanking us for a very rich webinar. She's had to go on before, but she's a program manager in UNESCO and has appreciated that. And Deepika, Martin, or Enrico, if there are any comments you'd like to make before we finish up.
Yeah, just thanks, Doug. You always assemble a glittering array of perspectives and ideas, and it's crucial that we keep in touch with each other. So thanks for the opportunity.
Thanks, Martin.
Yeah.
And you're close to your bedtime. No, you're middle of the day. Sorry. Yeah, Deepika.
Yeah, thank you, Doug, and it has really been a pleasure to collaborate on this. And because the fact-finding survey we have placed in the public domain, and as I mentioned, that we would like it to be a very robust tool which can really support countries. So if the other panel members here, if they would like to contribute, and I'm sure we would be circulating it to the larger mailing list also to further improve the language. Excellent. And the objectives. So yeah, over. Thank you. Thanks for, as I mentioned, being the driving force.
Thank you. Enrico, do you have any comments, or do you want to post anything in the chat box? I am just going to scan up the comments that were made. Suzanne has commented asking for opportunity to share. Anyway, that's good. Okay, I'm going to move towards closing up the session by, first of all, ending the recording.